I call this public board meeting for the Board of Education for School District 72, January 11, 2022, to order. And I will begin with my chairperson's remarks. Good evening. I acknowledge on behalf of the Board of Trustees that this meeting is being held on the traditional territory of the Likwitwa people. I am John Kerr, chairperson of the School District 72 Board of Education. In attendance this evening are Vice Chair Kat Eddy and trustees Joyce McMahon, Richard Franklin, Susan Wilson, Daryl Hagan, and Shannon Briggs. Also in attendance are Superintendent Dr. Jeremy Morrow, Associate Superintendents Morgan Kyle and Phil Sismic, as well as Secretary Treasurer Kevin Patrick. Present also are Lynn Logan, Assistant to the Superintendent, Jennifer Patrick, Manager of Communications, and providing technical support is Jonathan Carrier, IT Technician. This board is meeting virtually this evening under advice from the Office of the District Health Officer. The board will reassess how meetings are held when further information becomes available. Please note there is a 20-second production delay between the live event that you are viewing and the meeting participants. The question and answer function is open for questions on the agenda items for this meeting. Questions that are posed during the meeting will be addressed at the end of the session. In the 5 weeks since the board last met, Omicron has become the prevalent variant of COVID-19. It is far more transmissible than the previous variants, and despite its effects being milder for the majority of those who become infected, it can still have a serious effect on those who become its victims. Recent information indicates that up to 10% of children who are infected could experience long COVID with its resultant effects. While the board is taking every possible precaution to ensure the safety of staff and students, it is important to follow all safety protocols, including mask wearing, frequent hand washing, and doing daily health checks before attending school. However, the most effective and important action that parents can take is to have their children vaccinated. The latest statistics in BC indicate that only 40% of children aged 5 to 11 have received their first shot. It is also clear that unvaccinated people, adults or children, have several times the chance of becoming infected than those who are vaccinated, and the vast majority of those who have been hospitalized are unvaccinated. Further, pediatric hospitalizations are increasing with the increased prevalence of the Omicron variant. The most effective way to stop transmission of this virus is by vaccination. So I urge all staff and parents to be vaccinated and to make sure that their children have been vaccinated as well. Since the last board meeting in December, the situation in schools has changed once again. The Ministry of Education announced changes in how schools are expected to ensure the safety of staff and students. This resulted in a 4-day postponement of the opening of schools after the winter break. During the break, management worked to implement measures to ensure a smooth and safe opening. This is the second time since the end of the last school year that our management team has been required to use their break times to react to changes necessitated by the virus. And last week, our school staff spent their time preparing for the changes necessary to combat the spread of this virus and to ensure continuity of learning. Thank you to all who have worked to make our schools safer for our students. Your efforts are important and appreciated. Finally, I hope that everyone had a safe and restful winter break and that this upcoming term is a successful and safe one. To everyone, I extend my best wishes for a successful and healthy second term. Okay, we will move to the superintendent's remarks. Dr. Morrow.
Well, thank you very much, Chairperson Kerr. I just want to share how great it is to have students back. They arrived yesterday after an extended winter break, and I want to share with our community that we used the last week of this past week, both schools and district staff, to plan for a continuity of learning as we do respond to the changes and complexities in our schools as a result of the Omicron variant. We also have been working to have a plan in place for the potential functional closure of the school or district site if we do not have enough replacement staff to remain open. I want to commit to our parents and community that we'll do everything we can to ensure as minimal disruptions as possible to the continuity of learning for our students, and that we will be communicating clearly with families if there is any impact with the functional closure of a school. I do also want to take this opportunity to remind our parents that daily health checks remain in place, and that students and staff are reminded to stay home if they are sick, that they need to wear masks before entering the school building, and that schools have been working to limit face-to-face seating, to reduce congestion in the hallways and shared spaces. And they've been working and they have moved to virtual meetings as well as limiting visitor access to schools. But I want to share that you are still welcome at your child's school. All that we ask is that you make arrangements with the school prior to visiting the school campus for an appointment or so on. I want to share that Family Literacy Week will be launching on January the 23rd with community partners supporting and sponsoring a number of activities in the community, with Family Literacy Day actually occurring on January the 27th. Communications and promotions will be out in media, and particularly on the Campbell River Literacy Association Facebook page as well. It will be promoted on our district's social media. And while we talk about platforms, I'm excited to share that starting next week, this month, all school and school district websites will be hosted on a new platform. We are excited about this new platform because we anticipate that it will greatly enhance our ability to communicate in a timely way with parents. We're at that time of the year where we need to make sure community knows that kindergarten registration begins on January the 31st and runs until February the 4th. We have a number of good news items that I'm excited to share tonight. We did receive a $10,000 active school travel grant from BC Healthy Communities Society to support Phoenix students and families to be active on their journey to and from school. Georgina Knox, our physical literacy coordinator, will be working together with the project lead Sarah Wright and schools administration to facilitate this grant. Georgina has also secured a $6,500 grant from All Kids Bikes to encourage K-1 students to engage in cycling with the hope of building confidence and interest in biking to school when it is age appropriate. And an additional $2,000 grant has been awarded from Bikes Canada to support physical literacy for our kids, or Books Canada for physical literacy for our kids. We've also received an $8,000 grant from ITA that Student Option and Opportunities Coordinator Jeff Lanteo was able to procure, and it's to purchase toolkits for elementary schools to engage in curriculum around careers. So some exciting times are ahead for our elementary school students. I also want to take a moment to thank Dr. Charmaine Enns, who joined us on Friday last week to address concerns and answer questions from staff. And we have appreciated her clarity, her guidance, and her support of schools as our regional medical health officer. And she was in support of our schools before COVID and before this pandemic, but we certainly had more opportunities to connect with her over the past 2 years. So I would like to finish and close by thanking our hardworking snow clearing crews who spent all of last week clearing snow from district sites, as well as for our bus drivers for their care and professionalism while driving in such challenging conditions. And I want to finish by just thanking all staff and all of our parents for their patience, understanding, and support as we make changes once again in our system to respond to COVID-19. Thank you.
Thank you, Dr. Morrow. The next item on the agenda is approval of the minutes. The suggested motion is that the minutes of the meeting of December 7, 2021 are hereby approved as circulated. Do we have a mover for that, please? Trustee Franklin and Trustee Eddy. Is there any discussion? All those in favor, just raise your hands or say aye. Okay, the motion is passed. We'll move in. Is there any business arising from the minutes? Hearing none. Are there any additions or alterations to the agenda?
Board Chair Kerr, can I add pandemic update to educational submissions, please?
Yes, that's item 10. All right, that is added to the agenda. Are there any other?
Actually, if we could, Chair Kerr, add it to 12A.
12A? All right, we will do that. Thank you. Okay, are there any other additions or alterations to the agenda? Hearing none, I'm going to read the suggested motion that the agenda is hereby approved as amended. The agenda is hereby approved as amended. Moved by Trustee Eddy, seconded by Trustee Wilson. Any discussion? All those in favor?
Aye.
Okay. Motion is passed. The agenda, the next item on the agenda then will be item 11, electorate and board matters, and this is the board governance notice of motion, and that will be Trustee Eddy.
Just before we get there, Chairperson Kerr, can we go back to the report of board decisions from the confidential?
Oh, I'm sorry.
That's okay.
Yes, we can.
So
okay.
the report from the confidential meeting is that we discussed matters of legal and labor, and we have concluded our agenda for the evening and won't be required to go back.
Okay. Thank you for that reminder.
No problem.
Okay, then we will move on to item 11, and that will be board governance and notice of motion. Trustee Eddy.
I'd like to take this time to serve a notice of motion for a new board governance policy 29 regarding professional development funding allotments for exempt staff. This will come forward at next meeting. I'd also like to take this opportunity to thank Executive Assistant to the Superintendent, Lynn Logan, for her work in helping the Board Governance Committee develop this policy. Thank you.
Thank you. Okay. Next item will be educational issues, and that will be pandemic update, and that will be Associate Superintendent Sismic.
Okay, thank you. As you know, on December 29th, the province released an addendum to their October protocols and guidelines. And when we reviewed the addendum, it became very clear that as our district would have to make very few adjustments. And if you recall, in August or September, the board had made it very clear that they were not satisfied with us as a district just aiming for the minimum that was being set out by the province, that student and staff safety was paramount. And because we exceeded the minimum at that time, we are fully in compliance with most of the recommendations in the addendum. Since September, we've been exceeding in a number of areas. Things like midday cleaning at elementary schools. Our middle and secondary schools have always had daytime custodians. We've been upgrading our filters to the MERV 13 standard, even though our recycled air systems don't require, our fresh air intake systems don't require it. We've been making sure we've increased the amount of fresh air in our intake systems. Where ventilation hasn't been sufficient, we've purchased and installed portable HEPA filters. So these are all the current recommendations that we've been doing from September and even before that. And when we spoke with members of other districts, they had all stated that they had stopped doing those things in September with the new guidelines. But on your direction, we hadn't, and it's boded well for us. We've tasked our principals to work with their site-based health and safety committees to review other recommendations from the addendum. And things like staggered start and end times. The goal of staggered start and end times is to reduce congestion in the hallways and the doorways. And every school is going to be a little different. For example, most of our elementary schools have at least some, if not all, their classroom doors outside. If kids are coming to the classroom doors directly, there is no congestion in the hallway, so there is no need for a staggered start and end time. So our principals and vice principals are working with their staffs and looking at the recommendations to see what changes can be made and what we can do to mitigate any risk of congestion. The provincial health order continues to be 3-ply masks. That's the standard. We've secured an order for 100,000 masks from a local vendor, Canadian Tire, here in town at a good price. So we're well equipped for 100,000 masks will probably last us about 4 months, 3 to 4 months. and continued emphasis on hand hygiene and physical distancing. We're making sure that we have the sanitizers that we need for the long haul. And one point I just want to point out is that all these enhancements, the expectations still continue to be unfunded. So it's through support of this board that we're able to make sure that we're meeting and exceeding the health expectations for our students and staff. Thank you.
Thank you, Associate Superintendent Sismic. Are there any questions or comments on his report?
This is Daryl.
Yes, go ahead.
I know that in the press recently, they've been talking a lot about the N90 masks, and I'm not convinced at all that they're going to make any or even some difference. I believe that we had a conversation with our local person in charge. Can I hear that conversation, a little bit of it, please?
So Dr. Enns, we had a town hall last week, and Dr. Enns is the North Island Medical Health Officer, and she reiterated that the 3-ply mask is sufficient for the school settings. There's a challenge with N95 masks. One, wearing them throughout the day makes it even more difficult to breathe because they are 95% filtration. They're largely reserved for the healthcare system. And then the other part is actually finding them. And just to give you an example, even though it's not mandated as part of our kind of process, we're still looking through suppliers, and finding them is near impossible on the island, in the province, and even throughout Canada, because as soon as there is a supply, they're scooped up. And I'm not talking about scooped up in a week, I'm talking minutes. I've been on the phone with a supplier and put an order in just as preparation, and literally in the 2 minutes that the order was processed, hundreds of cases have gone. And when they check with manufacturers like 3M, they're not going to be backfilling those orders because the new orders are all going to healthcare.
Yeah, thanks, Bill.
Any other questions or comments? Okay, thank you very much. And we don't have any other, do we have any other items on the agenda? There's nothing for business administration, committee reports, any other business. So the last item on the agenda will be any questions from anyone present or anyone online, I guess, for agenda items for this meeting. Ms. Patrick, do we have any questions?
No questions have come in yet, Chairperson Kerr.
Okay, we'll give it about a minute or so. If nothing comes in, then we will be finished for the day, evening.
Absolutely.
I have to remark that this has probably been one of the shortest meetings that I've ever been involved in. Looks like 18 minutes. Well, I will declare that that minute has passed, so I will entertain a motion for adjournment.
Daryl, so moves.
Okay, seconded by Susan Wilson. All those in favor?
Aye.
Aye.
Okay, the motion is passed. We stand adjourned. Thank you very much.